here who were not able to attend. We had over 115 people register for this evening, so it's full. If you have questions, please drop them in the chat at the bottom. You'll see the chat sign. Click it, and then you can write what you want in there, and we'll get to those questions. Tonight's agenda will be, we're going to focus on two specific areas. We've invited Dr. Earl Stoddard, who is the Director of Emergency Management and Homeland Security, and he will update and share really all things testing and vaccine, because I know that's a very hot topic right now. We've also invited Amy Cropp, who is the Division Director of Prekindergarten Special Programs and Related Services, part of the Office of Special Education. She will be talking to us about reopening of MCPS and the impact to our youngest children in pre-K and special ed. So before we start this evening, I did want to make one quick announcement. Before I turn it over to our guests, I just want to remind everyone that yesterday MSDE did come out with their State Childcare Relief Fund grant. The application went live yesterday. This are funds that were appropriated for direct relief to childcare. We will be hosting some webinars to go over the application process. They will be held in English and Spanish, so watch your emails, please, so that you can sign up for those. We will do it up to 100 people for each one, so you should have a chance to get in. They will also be recorded so that we can have those on our social media platforms and you can get that information. Okay, so I'm going to introduce our first guest, Dr. Stoddard, who, as I said, is the Director of Emergency Management and Homeland Security, who's going to update us and share with us about testing and vaccines. Dr. Stoddard, good evening.
Thank you, Jennifer. Thank you for everyone attending. Thank you for having me. I'm going to try and go through fairly quickly because I want to leave a lot of time for questions. I'm sure you'll have many, but I do know that there were some questions that I got in advance that I think I can try and address as much as possible through my comments before, so I can, we can see what else questions we have in the chat. So I'll start off with testing. I know a lot of people are interested in vaccination, but I want to remind people about testing. So right now, the county is doing approximately just short of 6,000 total COVID tests per week right now. That's actually far short of our volume, which means that people are not actually coming in to get tested in as high numbers as they were earlier in the year and towards the end of last year around their holidays. This is not at all necessarily surprising because what ends up happening is people who've been, around other people or may have been exposed more frequently tend to get tested more frequently. And therefore, when you see less people interacting with other people, you tend to see less testing in the community. That said, for a population like our childcare providers, this does open up a lot of opportunities for you all to come into any of our county testing locations for free and frequent COVID-19 testing whenever you see fit. For the most part, we're utilizing the anterior nasal, which is just the front of the nose swab. We are doing some saliva-based testing in some of our clinics as well. If you're interested in seeing the schedule for our testing opportunities, you can find that on our website. It's montgomerycountymd.gov/COVID-19/testing. It has a schedule every day of the testing opportunities across the county. You go in, you get tested. Typically, 48 to 72 hours later, you'll get your results, obviously that's great for knowing your status. Now, how often should we be getting tested? It depends in large part how much you're interacting with people that you are not part of your normal household. As childcare providers, I know that that's pretty frequently. But what I would say is it probably depends also in part when you're a childcare provider on how many families you may be individually working with and how your perception of how much those families may be interacting with others as well. So what does that mean? If you have a small classroom of students or you're in a small childcare provider, maybe you get tested every couple weeks or every 3 weeks. If you're in a larger center or have more children coming in and interacting with you on a regular basis, more family members, then you can get tested weekly if you're inclined. I would say, the safe bet is probably every other week. Getting tested is probably a good middle of the road. It does not take a long time at our testing sites now, given how, frankly, demand is much lower right now. So it does not take you a long time to come in and get tested. And obviously, being able to maintain that is an important point moving forward. Test results are generally given both. There's a call option and an email option, depending on what you want to sign up for. You can get both. When you register for your testing appointment, it'll ask you how you'd like to be contacted with your results. You fill that in, and that's how you'll typically get information. People have asked also about rapid testing. The county's not doing a whole lot of rapid testing right now. We're actually working on this with the state to get up a machine to be doing in some settings, but not at our public clinics. Rapid testing, the new rapid testing available that if you were inclined to go get it through another source besides the county is very accurate now. You can get results typically in 15 to 20 minutes or so. Often many providers right now who are doing it do charge for that. So obviously that would be something you'd have to determine for how you wanted to access it. But it is the newer rapid testing is quite accurate and quite effective, and really just as accurate and effective as some of the PCR antigen testing that you'll see in most settings. That's the kind of setting the county's doing. Talking a little bit about the new COVID-19 variants. You've heard about the UK variant, the Brazil variant, there's a South African variant. Frankly, there's an LA variant. There's at least 7 variants that are in the United States already that are share similar characteristics from the ones you hear the most about, which is the UK strain. South Africa and Brazil strains are the most commonly referred to. They all have similar mutations in them that give them some transmission, some increased transmission qualities relative to the normal standard COVID strains that we're used to be dealing with. I think it's pretty clear that in the United States, there really has not been an effort to stop the spread of COVID-19. There's been an effort to mitigate the spread of COVID-19. And what that means is that we're not going to stop the spread of these new variants. I think over the next 6 to 8 weeks, you will see them become increasingly prevalent in not just Montgomery County and Maryland, but also in the United States of America. And obviously that will pose a challenge that I think will in part be mitigated by the fact that we are increasing vaccinations every week, both in the county and across the state and the country. But also that 15 to 30% of our population, that's not just the Montgomery County, that's across the United States, has already been exposed to and likely infected by COVID-19, which frankly means that there is some baseline level of immunity within our communities before we add on the 13 or 14% of people that are now vaccinated through various vaccination opportunities. The state is doing laboratory testing of positive COVID cases for the variant strain and has detected a few variants in Montgomery County. Several of those have been travel related, meaning people who have traveled to countries where those variants are spreading more rapidly. But at least a few in other parts of Maryland and in the National Capital Region have been not travel related, which means that they're from community transmission. So I have every reason to believe that there are variants spreading right now in Montgomery County, and they will likely continue to do so. That does mean that we should stay vigilant. If you do have, frequent testing is the best way to help us find those variants. But candidly, even as we find them, the mitigation methods for these new variants are not substantially different from what we would do for the normal strain of COVID-19. So it's really good for us to know about so we can track the spread of these, but obviously it's not going to substantially change what you would do to prevent the spread of COVID-19 for these variants. I think that's all I want to talk about for testing. I'm going to go into vaccine a fair bit because I know that's what everyone wants to talk about. So right now in Montgomery County, there are several opportunities to get vaccinated. The county has some opportunities that we're focusing on our 75 and older population. The hospitals have various opportunities that they're focusing on different populations themselves. Then there are the Giants, the Safeways, the CVSs, and other mechanisms that you can get vaccinated by sign up. And then finally, there are these new mass vaccination sites that are opening up across the state. Right now, they are at Six Flags in Prince George's County, as well as the Convention Center in Baltimore City, and soon to be M&T Bank Stadium in Baltimore City as well. The state has identified 3 potential additional new locations for mass vaccination sites. None of them are currently in Montgomery County. We are continuing to advocate for the state to host a mass vaccination site in the county. Thus far, they have not been receptive to our requests, but we're going to continue to advocate for a site that could service Montgomery County, because we know that that is something that our residents should be able to enjoy just as other residents across the state are. Mass vaccination sites are ramping up. You know, the state has seen an increase of approximately, beginning next week, I think 50% since January 20th inauguration with the new administration. Unfortunately, Montgomery County has not seen at the local health department nor at the hospital level that same level of increase. In fact, this will be 3 weeks in a row that we've received 4,500 doses through the local health department, which obviously impacts the level of vaccination that we can do. Most of the opportunities across the state are all following the state's 1A, 1B, 1C stratification, meaning that if you're a child care provider and you want to go to a mass vaccination site in Prince George's County, you are certainly eligible and are able to do so. The county health department, on the other hand, is going through our phases more methodically than the state is, and we're currently focused on vaccinating our 75 and older population in Montgomery County. There are approximately 73,000 individuals in Montgomery County over the age of 75. At this point, a first dose has been given to just short of 40,000 of those individuals. It's actually about just sort of about 35,000 actually. So we're at 48.4% of our 75 and older population having received a first dose of the vaccine. We're getting through approximately 12, 13, 14% a week. So doing that math, knowing that we're, not everyone's going to want to take it, we're probably going to be vaccinating 75 and older population for about the next 3 weeks before we move into the next tier within the county health department infrastructure, which does include the child care workers. We are doing a small pilot per the state requirement that we actually do educators. We're actually putting our educator allotment towards our child care providers. We're working with Jennifer and Dr. Andrews and Joanne Barnes and others at HHS and Children, Youth, and Families to identify particularly our special needs child care providers, as well as I think we're going to move on to, once we get through that pool, into the early childhood, so the newborns and toddler programs as well. Obviously, our goal is to get to the 75 and older population and greatly expand the opportunities available to child care providers through those mechanisms. Now, we are often asked, why is the county vaccinating educators and not child care workers? The county is actually not vaccinating educators at all. The county health department, that is. The educators are actually being vaccinated through Johns Hopkins. Hopkins basically approached the county and MCPS, as well as our non-public schools. They were looking for a discrete pool of people to vaccinate, for which they could get lists directly from facilities. And they approached us and said, could we do the school systems, because of our experience working with the Baltimore County and Baltimore City school systems through the Hopkins network. And, they wanted to go down the road. We supported them in doing that. And so that is one opportunity that is available through the educators. Now, child care providers, as I said, can absolutely go to all of the vaccination efforts, whether it be Giant, Safeway, any of those. I believe also the Adventist system is signing up directly. MedStar is focusing on Leisure World right now. And I think, Holy Cross also has some mostly open opportunities that you can sign up for. Now, we understand that those opportunities are rare and hard to come by. That is the nature of the fact that we get 15,000 doses as a system per week, meaning the hospitals and county health department, about 200 doses a week for each of the supermarket sites, the Giants and CVS's. And what those add up to is no more than 20,000 doses a week going to 300,000 people who are eligible right now. And so obviously, as we move through these tiers, there is never going to be enough vaccine to say, this week we're covering every childcare worker there is. That's never going to happen. Just as there will never be a week where we say every MCPS educator or grocery store worker or anything is going to vaccinate all at once. So I would expect opportunities, just like I said, through the county in maybe 3 weeks or so to open up to childcare workers. And I would expect similarly the opportunities through the hospitals and other sites to open up more to childcare workers. But given that we believe there's approximately 15,000 of you childcare workers in the county, it's going to be several weeks, if not a few months, before we get through the entire pool of childcare workers in Montgomery County, unless we see a substantial increase in the amount of vaccine coming to the state of Maryland. That's just, I think, where we're at. We know childcare workers are included in the same tier as teachers, there are more than 30,000 educators in Montgomery County and education staff. They're in the same tier as grocery store workers, of which there are several thousand, transit workers, which there are several thousand. So there's a lot of people in the tier that also share with the childcare workers. So I think it's just important to understand that we are moving as fast as we can. We're not jumping to other categories ahead of you. It's just that we're not getting enough vaccine to get through as many of the people in the tier above, which is the 75 and older population, and in your tier, which is shared with a lot of other people. So I think it's just trying to manage your expectations and have you understand exactly where we are. A few other questions I want to touch on. Vaccination is not going to be mandatory. In fact, we're going through, even in the healthcare worker population, there are some number of people who are refusing to take the vaccine. We're going to continue to encourage those people to take the vaccine. We think that by showing people who get vaccinated, having them not have bad experiences with the vaccine, we can encourage other people to get vaccinated. As far as how often we'll need to get vaccinated, obviously most of the vaccines, all the current vaccines available right now are a 2-dose regime. The Pfizer vaccine is separated by 3 weeks from your first dose to your second dose. The Moderna vaccine is 4 weeks. The Johnson & Johnson vaccine, which is coming up for approval, consideration for approval by the FDA next week, is a 1-dose vaccine. And so obviously that would be a great addition to our portfolio of vaccines. There are other vaccines being developed by AstraZeneca and Novavax and others, which are a mix of 1-dose and 2-dose regimens. I think most of them are actually 2-dose regimens that will be coming on board in the weeks and months to come. I think, as Dr. Fauci has said, we're probably talking about really getting into May or June before we have enough vaccine to be able to offer it to just about everyone who wants it. And then we really get into the phase of really trying to convince those who have been a little bit more apprehensive about getting it to actually receive it. The more we're going to need to get a significant portion of the population vaccinated to be able to reduce the numbers of COVID-19 and for us to be able to get back to a closer sense of normalcy to what we are today. That said, numbers for COVID-19 are going down dramatically in Montgomery County. We are looking at additional things that for consideration for reopening. I know that the childcare ratios are one of the things that have been discussed and we will continue to look at in Montgomery County. We're not ready to announce anything today, but obviously we can see where the numbers are going. We're incredibly encouraged by that. We want to make sure that we can, see a sustained reduction. Obviously, we just opened indoor dining last week, and assuming that goes well, we want to see how, make sure the trends continue. And then over the coming weeks, I think we're going to likely see additional things come on board for reopening. We have to stay vigilant. We have to continue to do the good social distancing and face coverings and cleaning and all the things that we've talked about doing, even as we increase the activities, because obviously going backwards, particularly in light of the variants that are coming, that are spreading, is something we cannot have, and we've got to make sure that we, can stay vigilant even while we do additional reopenings. The last thing I'll say is we're going to be doing these mitigation activities for many more months, meaning distancing, face coverings, cleaning, washing hands are likely going to be with us at least into the fall to some degree, and perhaps even beyond that. It all comes down to how fast we can get people vaccinated and the number of people that choose to get vaccinated. Vaccination is not a 100% protection. There are still some people who will get vaccinated and still get COVID. Their symptoms are typically far weaker. But obviously, you know, we need as many people to get vaccinated as possible so that we can actually develop that herd immunity that we often hear about. And so I think that's all I wanted to cover. I'm certainly sure I missed a few of the questions in this document, but we can get to them through presentation. And I think we'll probably have our my colleague from talk next.
Okay, well, thank you so much, Dr. Stoddard. I really appreciate it. A lot of information that was just given. So I'm sure people will need to process everything that was just said. And when we get to the Q&A part, definitely please throw your questions into the chat and we'll give you opportunities also to engage with Dr. Stoddard. Next, we have Amy Cropp, as I said, Director of the Division of Pre-Kindergarten Special Programs and Related Services in the Office of Special Education. Wow, Amy, you have a really long title. So this evening, she's going to talk to us a little bit about reopening of public schools, in-school instruction, and our youngest children are pre-K and special ed. As Dr. Stoddard had mentioned, priority within childcare was first for vaccines was for those childcare programs that are serving children who are receiving services either through the infant toddler program or through the preschool education program, PEP, as well as programs in public schools, childcare and public space. So Amy, I'm going to hand it off to you now.
Thank you. Good evening. First of all, it's so nice to see so many familiar names I don't sit in meetings too much with anymore. And thank you. And Jennifer, I just want to say that this partnership that we have had over the past, several years is really, I think, been one of our most successful partnerships. Just the work we can do in special education and DHHS, and I think a perfect example of that is the way we've collaborated to work with our childcare providers who are working every day, all day, every day with students with the most significant disabilities, the birth to 5-year-olds with those most significant disabilities. So thank you. Our partnership has been great. I want to be able to answer any questions I know about schools reopening. I know a lot. I also don't know a lot, and a lot changes. So every time I open my mouth about schools reopening, I say, as of date stamp, February 17th, here's what I know. And if I don't know the answer, I don't hazard any guesses. So I'm always happy to take questions back, get the right answers from the people who know the right answers, and get them back to you through Jennifer. The worst thing I could do is give you a wrong answer. So I want to make sure that I'm giving clear answers and accurate and truthful and hitting all the topics that I know are out there heavily weighing on everybody's mind. I will also say that we know in special education and in pre-K that children who have been spending their time with you in childcare since March, April, May, September have a leg up on other students who have not had that opportunity. So students coming back to us, and I'll talk about the dates in a minute, but students who are coming back to us after many months away from the structure of school, they have had better experiences potentially with you than they have otherwise. That's never been more true now, that you're giving students in our world, a leg up that they need. We've always known it. It's never been more true than now. And it will not be more apparent than the first couple of weeks when our children walk in the door learning to be students, but those who've been with you have a leg up. And a lot of the work we've done has grown out of some of my collaborations with childcare providers, and sometimes just calling up childcare providers I know and saying, how are you doing this? It's August. What have you done? It's August. What have you done? And building that into our work here. So with that introduction, I want to hit on the topics that I know were on folks' minds. I'll talk about the overview is that with school opening, the Board of Education makes all the decisions about the school openings, closings, openings back up, all that stuff. So they came up with, they voted on a proposal that I'll talk about in a minute on February 9th. So we're moving ahead with that proposal. On February 23rd, they come back to a Board of Education meeting and give the very final stamp of approval or not on that plan. So what I'm telling you, the dates I'm going to give you in a minute are what the board voted on February 9th to be confirmed February 23rd. So it could always change, but I'm giving you all the information we are moving ahead with. But wait until February 23rd. I'm hoping and optimistic that we get that final rubber stamp of approval. Dr. Stoddard just kind of, I think, told me why I can be more optimistic about that, given the data. So I'm looking forward to hearing that and then just push and go. So let me go through the dates And I could spend an hour talking about the various iterations of students in MCPS and when they're coming in, and I could confuse everybody. I'm going to really hit the highlights. The highlights are that March 1st, MCPS will have our first groups of students back in the door. They are students with the most significant disabilities. So it's less than 1,000 students or so, kindergarten on up through age 21, so no pre-kindergarten students. But on March 1st, we will have our small groups of students with very significant disabilities, kindergarten age all the way through high school, who are in our special ed programs for students with autism, cognitive disabilities, in our programs that we call extensions programs, the autism programs, school community-based programs, and our special schools, which are Stephen Knowles and Longview, and Carl Sandburg and Ruck Terrace. Many of those are older students, but so those are the small groups of students that will be coming back on March 1st. I'll also say some high school programs, just to round out to demonstrate the complexity. Also some high school students who are working on like certification programs. So it's not just special education students, but largely. That goes well for a couple of weeks and we're good to go on those students. March 15th rolls around and a much bigger number of students come in. That's when we will have our special education pre-K students. So students in programs that may sound familiar, like PEP is our big one, PEP, HAP, pre-K physical disabilities programs. Every student who's in a pre-K special education program comes back on March 15th, along with kindergarten through third graders. I'm going to look at this slide because I want to make sure so special education pre-K students on March 15th and kindergarten to grade 3 students. Another few weeks goes by and we're all going swimmingly and everything's great. April 6th is our target date for general education pre-K students and 4th and 5th graders. So general education pre-K, the ones who leave your programs and go to Head Start or to pre-K classes, those students will come in on April 6th. So it sounds a little awkward, but special education pre-K students will be there for a couple of weeks before their non-disabled general education pre-K students friends roll in. And then we could go up in age, but then it rolls in with grades 4 and 5 down the road, but I'll focus on sort of kindergarten to grade 3. All MCPS students are going to be receiving virtual instruction only on Wednesdays. So all of these scenarios I'm talking about, students are virtual on Wednesdays. No students are coming into school buildings on Wednesdays. So no matter what their class is, returns, just whatever Wednesday looks like now for a student, that's what it'll look like when they're coming to school. And then pre-K students, special education pre-K students and general education pre-K students will come Monday, Tuesday, Thursday, Friday, every week. As students get older, like 2nd grade, depending on the kind of school, whether it's a Title I school or not a Title I school, some students will be going to school every other week, like in an A-B rotation, Monday, Tuesday, Thursday, Friday. But it depends on the type of school. So I don't even want to complicate it because it's a little more individual. But know that pre-K general education and pre-K special education will come every week, Monday, Tuesday, Thursday, Friday. The caveat of this is families will always have the ability to keep their children learning virtually. And for a variety of reasons, a large percentage of families have opted to do that. Some I suspect because they are very, very successful with you, and that's been their family preference to continue what's been working for their family. So families will always have the option to maintain virtual learning just like it is today. Families, in December, every family was sent a preference survey. We're not re-surveying families, but families now who say, you know what, I really want to change my preference from, I wasn't so sure, the numbers look different, I felt differently, or I just, I didn't understand enough back then, now I want to come now I want to keep my student home. That's fine. There is going to be a blackout date just because we got to plan and figure out bus routes and all that. So there's about a 2-week blackout window when no changes can be made on the parent preference. 2 weeks prior to each kind of rolling in so that principals can, you know, nail down their student rosters and their sectioning and setting up the classrooms and all that. So about 2 weeks before each phase in, there's a blackout date. Families can always go from in-person to virtual. Going from virtual, my family preference in December was virtual to in-person. Like now I want to have my child attend school in person is harder. And it's harder because we really have to look at capacity. I mean, Dr. Stoddard will back me up when we say we are counting 6 feet, and I'll talk about all the safety precautions in a minute, but it's almost down to like a science that principals have to go through and building services to figure out how many students fit where, when, and how. So it's much harder. We are always, going to want to honor families' preferences, but we're pretty honest that at some point we're not going to, there are some school buildings that just don't have capacity for families that haven't already opted to go in person. It's always a discussion to be had with the principal. So if any families want to, revisit that now, they should reach out to their school. I'm going to monitor the chat in a minute, but I'm going to hit the major points of this. There are many of you have children who receive speech therapy only. They're pre-kindergarten students, and they typically get on a bus and they go to a school nearby to meet with their speech therapist for 45 minutes a week, and they come back. And since school closure, they've been receiving that through a televisit. That's going to continue. We are not bringing students in just, whose only service in MCPS is like 45 minutes a week of speech therapy. Those students are going to remain. We're not going to bring those into a school building. So that what we call itinerant pre-K speech therapy will continue as it is now. However, that's working for the child now. And let me go through a couple, Jennifer, if you think it's fine, more themes and then circle back to the questions.
Fine.
Couple more, one thing I want to say on transportation, I know was a question. Buses will be running. Families opted in to, do I want my child to go on a bus? A lot of people feel really different, about going to school than riding the bus. Families had the option to say, I want my child to ride a bus or not, and we'll continue to work with people who change their mind on that. School buses are going to be one child per seat, one child or household member, siblings could sit together per seat. So no doubling or tripling up like the bus capacity would allow. One child per seat. I'm going to get to masks because I'm sure that's the next question about buses, and I'm going to answer it when I talk about masks in general. But so the buses are running just like they are for families who opted in. Special education students will always have bus transportation offered to them. It's part of their program. But just know that we're doing one student, one child per bus, unless they're siblings or something. Or per seat. If I said per bus, that is not right. Per seat. So you're aware for your planning purposes, all schools right now is 9 to 3:15. When we start opening up buildings on March 15th, it's going to revert to that time where elementary schools start either at, one of two different times. In the high schools, those high schoolers are going to have to get up really early and be at school at 7:45, and the middle schoolers. So because transportation drives that stuff, school start times will go back to what they were pre-pandemic on March 15th. And so that was not a great conversation I had with my 17-year-old that he's about to have to get up before 8:55 a.m. when he goes to school, and it will actually be more like 6:55 a.m. So that was a fun conversation, but it's not such a significant difference for elementary students. Infants and toddlers, and then I'll talk about safety precautions and plans and that kind of thing. Infants and toddlers continues to remain virtual. Our staff are not going to go into any buildings that aren't MCPS facilities at this point. So our staff are going into MCPS facilities only. So we will not be coming into your childcares, either infants and toddlers providers, pre-K, itinerant teachers, all the services all those services will continue virtually as they have. So at this point, there is no No plans for infants and toddlers providers to resume providing services in childcare or homes at this point. Let me go through, Jennifer, let me go through and then I'll come back to this whole safety and precautions, because maybe that's a bigger, will online school end in April? Absolutely not. There are going to be students who, families have different thoughts, philosophies, ideas. In some cases, virtual learning is working out really well. Online school is not, there will be no change. The only changes in March and April and the rest of the school year is that families will have that option to return to partial in school. Online school as it is, I can't talk about next year, but I can sure talk until the end of this school year, will remain an option for students and families.
I think that's it.
Michelle's comment, I think her question was, about childcare's. Oh,
yeah, I answered it.
Okay.
I think you can talk about the safety parts now.
Perfect. Okay. So this has really been what's consuming our time and our collaboration. We have pretty explicit, detailed plans to mitigate as many risks as possible. This is where we have quite honestly looked to the successful childcares, because you have been doing this a lot longer than we have under different but similar conditions. So a lot of the methodologies that are put together will sound really familiar, and have also been, we've benchmarked with other school districts, we've read the research, we've talked to experts across the country, and a lot of it it's going to sound very familiar to what you're doing. And there's a reason for that. It's because it's worked for you successfully. So all of our students in MCPS, students and staff, will be wearing masks. The expectation is that they will wear masks. We understand that there are students, either developmentally because of their age or because of a disability, some students with autism, some students who have medical disabilities, some students with sensory or behavioral disabilities. We can hope for the best and plan that there are going to be times when there are students who are not going to be wearing masks. So what we've done to address that is, first, we're going to use everything as a teachable moment. We are going to frontline, and what our teachers are doing now is on their virtual classes, starting things like social stories. Hey guys, let's practice wearing our masks. Everybody, I'm in my home virtual classroom. You're all in your homes. Let's put on our masks and have mask day. Bring your stuffed animal and show me your stuffed animal, and have your stuffed animal show me how he wears his mask. A lot of social stories. We want students to recognize their teachers even when their teachers are wearing masks, because it would be disconcerting to be very familiar with the teacher that you've seen every day, all day, every day for 6 months, and then you get to school and she or he looks very different. So we're trying to do lots of front loading of that kind of stuff now. A lot of social stories, it's a strategy, particularly for students with autism. Teaching incremental steps, we're doing that. We've learned from you that children are really going to pleasantly surprise us. I think that, I did not believe when I started talking to childcare providers back, I don't know, June, July, August, how successful our kids would be. And I know that from you, because that's what they've learned. And that's the expectation. So, and the other piece is for the students who we know are not likely to be successful at fully mask wearing or socially distancing. Students with autism, one of their characteristics is they're not great social distancers. So the pandemic hits them in multiple ways. One is this hits at a deficit for them. We already know that they're not good at social distancing. Here it hits them with a double kind of an added factor. So we have supplemental PPE. So all the school system has that regular base tier of PPE, masks, hand sanitizer, et cetera, that I'm sure Dr. Stoddard has been in on the plannings of. What we've done for our special education programs is procure enhanced or supplemental PPE. So each staff person has kits and they're getting to their school, and the kits include goggles and gowns and KN95 masks and booties and face shields. And for our speech pathologists and our staff that work with Students who are deaf or hard of hearing, we purchased clear masks so that, because imagine a speech therapist needs to have his or her mouth seen. So we have that for special education programs. So that's another sort of way to mitigate the risk, because we know that our expectation school system wide is 6 feet distance. We know that that's not the case. And we're going to use those as teachable moments, but that's hence the need for this supplemental PPE that we're providing to all of our staff. Face shields, another reason we're asking our teachers, start putting on those goggles and face shields right now, because you got a month to help your student understand that it's not scary. And again, these are a lot of things we've learned from you. If you do have children who are going into MCPS, going to school, and you have found tips or tricks that work with that particular child on mask wearing, just use this prompt or remind him in this way, or he likes to do it this way, please share with us. Please, let your child's teacher know that. We have a lot of training coming up on how to use PPE successfully, especially this enhanced PPE for staff working with students with disabilities. We call it close contact surfaces. Close contact services. That's like our physical therapists, our occupational therapists, folks who know we're going to have to self-care, toileting, feeding. They're going to have to be hands-on. Well, the supplemental PPE and professional learning around that. Some of our special education programs, and it includes pre-K, we're using these cohorting models. So where we have a school with like 2 or 3 special ed or general education pre-K classes next to each other, that becomes a cohort. So the staff and the students in those 2 or 3 classes kind of become their own bubble with very little interaction. We're going to keep those as kind of consistent as possible, knowing that there's always going to be interruptions to that. But so we'll try to keep cohorts together, 2 or 3 classes together, and not have them, in high school, you're going to have kids walking all over the buildings. 5th graders are going to be, maintained, but there's still going to be a lot more fluidity than we are going to have in our pre-K classrooms. So we're going to be pretty harsh on that cohort model. And then schools have looked at their buildings, which bathrooms, the kindergartners are only going to use these bathrooms. The, kindergarten and 1st graders are going to come in the front door, and the 2nd and 3rd graders are going to come in the back door, because we're going to keep you separated that way. So all these things are just ways to mitigate the risk of having students in the building. And I think that was those were all the questions I think I had tasked in advance, but I'm happy to answer more, or Jennifer, catch me if I'm not right about that.
So yes, first of all, thank you so much. I think, working in a school with greater numbers of children poses more challenges than in childcare programs. So hats off to MCPS for putting so much effort and a lot of work into trying to really mitigate and keep the children safe, as well as the adults in the school. I think you did hit everything. Thank you, everyone. When you submitted your registration, you had put down questions. So I grouped those together and gave it to our speakers so that they could guide their presentation this evening. And I'm reviewing everything. I think we've hit everything. So I do want to stress, for those programs that have children who are in PEP or ITP, I think it is important. They've been in your programs, and now there's going to be a change. And we know with children under 5, a change in their schedule always results in some disruption in behavior. So I think it's important to keep those lines of communication open with the therapist about what has been successful, what has been working, as well as what hasn't been working. So that way we can really provide the best service for those children. I am going to open it up now to everyone to, you'll be able to unmute yourselves. I hope I clicked the right button, or, oh, it's already done. So that you can ask questions to either Dr. Stoddard or to Amy on the topics of testing, vaccines, and MCPS reopening. So you can also put questions in the chat if you are more comfortable with that, and I can ask those. Let me just make one quick announcement in Spanish. Para las personas que hablan español, si quieren, por favor, dejan sus preguntas en el chat y yo le puedo hacer la pregunta a Dr. Stoddard o a Amy Cropp. So please, I'm going to stop talking now and give you guys a moment to engage. So I'm just going to say unmute and jump in. I did that right. All right, Victoria, did I do that right? Can everyone unmute themselves?
Yes, only have to press unmute and they can talk.
Okay, great. Okay, who would like to start off our questions?
I'll start with a question. Dr. Stoddard, could you just re-emphasize or re-explain how vaccines are distributed and what the county itself has control over versus the total number that come to the county?
Sure. So let's start off with the state of Maryland. The state of Maryland is receiving about 90, I believe, 6,000 or 7,000 vaccines from the federal government right now. Those are divvied up through a number of different avenues. The Montgomery County Department of Health and Human Services receives approximately 4,500 doses per week. The hospitals in combination receive about 7,000 doses per week. Maybe a little bit more than I think Kaiser receives, about 1,500, and a few other NIH. And then obviously the private sector pharmacies, the Giants, the Walgreens, the CVS, and others. So we control, even within the Montgomery County allotment that was going to facilities, particularly in Montgomery County, about a third or less of the total doses coming to Montgomery County from the health department perspective. And obviously from the state perspective, we control 5% essentially of the doses coming into the state. And so obviously we have a very large county of 1 million people. We have certainly about 300,000 people who are in phases 1A, B, and C. And getting through even any section of those is very hard to do.
Just a follow-up. A lot of our families come to our centers, live in households where there may be a grandmother or an older adult. How do they get registered to make sure that they're getting their vaccine when they're either when they're 75 or whenever the next group comes in?
Sure. And BB, you're cheating because I know you're not specifically a childcare provider, but that's okay.
I was one for many years.
I know. So on our county website, we do have a pre-registration page. On that pre-registration page, you'll be asked a lot of questions about your age, whether you have any underlying health conditions, your profession, and other characteristics. And we use that to place you into the tiers for our system. So for the older adults over the age of 75, we're vaccinating that population right now. As I noted before, we're about 50%, about 48% into getting first doses into the arms of 75 and older population. We will move from there into additional tiers of phase 1B, including the childcare workers in the next phase. But anyone who's in 1A, 1B, or 1C should absolutely be pre-registering now. And that is the list that we are essentially pulling names from when we send out our invitation. So, for example, we've now made an offer of a vaccination to everyone over the age of 100 in Montgomery County. As we allow those spots to be filled, we'll move into 90 plus, and we'll do that as well. And we're doing it concurrently with targeting some of these efforts to the zip codes where we've had a lot of cases.
Let me just add to that, Dr. Stoddard. I did put in the chat the link for the where you can go to the county's portal and register. All childcare providers should be registering on there. There is a checkbox that you click that says licensed childcare worker that will put you in that category. So when we get to the point where we're opening and collecting the names of who to be assigned to get their vaccines, you'll pop up on that list. It is important when you register to monitor your emails. I have heard from some people that the email will either go to a spam or junk folder, so monitor that. It comes from C19 Vaccines, I believe, at Montgomery County MD. Is that correct?
C19 vaccination.
Vaccination.
Yeah.
Thank you. But make sure, put in your address book so it doesn't get lost in your emails. The other thing is that link that you receive is not to be shared once you get your approval for a vaccine. It's not to be shared. We've had a couple incidences within the childcare community where it's been mass given out and it backlogs, and we want to ensure those who are in the queue get the vaccine. To date, I can tell you from the priority group in childcare, we already have 5 clinics that have either been offered or scheduled. I think we have 2 more scheduled through March. We're just going down the list and just trying to get through them as fast as possible. The nurses are working really hard to get those done. So again, I think the big takeaway is register online, monitor your emails. You will not get an email the next day. You'll get something that says they've received your registration, but your actual vaccine it'll take some time to get there, but we are getting there.
I would just note, pre-registering with Montgomery County is how you get on the list for the county. We're also sharing our list with a few of the hospital partners, but you will have to go independently through the mass vaccination site the states are organizing. If you want to go to that location, or if you want to go to a Giant, you have to go to the Giant. If you want to go to the Walgreens, you have to go to the Walgreens. Ideally, we would have a countywide or a statewide pre-registration system, but that is not the direction the state has chosen to go at this point. There's some difficulties going that way, but obviously from a resident perspective, we believe that sort of a more centralized vehicle would be easier for people, and so we have advocated for that, but that's not the way it's set up right now.
Dr. Stoddard, I have 2 questions here from our providers. The first one is, if you are a child care worker in Montgomery County but live outside of the county, do you qualify for receiving a vaccine in Montgomery County?
Yes, and you'll actually qualify to receive a vaccination in Prince George's County as well. I believe that's where they live. So you actually can register through either or both portals and maximize your opportunity to get a vaccine through either. And obviously, like the mass vaccination plans, you can live anywhere in the state, work anywhere in the state. You can live in the state and work outside of the state and still be vaccinated. So yes, if you work in Montgomery County but live somewhere else, we will vaccinate you based on your profession.
Great. And then the second question is, I don't know if you can answer this. If you are fully vaccinated, can you still get COVID? I think I know
Short
the
answer, yes. Short answer is yes, you can. It is very rare. I think there was a story over the weekend where I think they've had 4 such cases in Oregon. But obviously, I think that there were, even in the vaccine trials, in the 10,000 who got the vaccine, there were still a handful of cases within the people who got the vaccination within the clinical trials. Most of the vaccinations are approximately 95% effective. Most of the times they're measuring essentially severe disease, but they're in almost all cases where someone who has gotten, in fact, all cases that I'm aware of, I'm not sure anyone who's been vaccinated has had a severe case of COVID that resulted in either a hospitalization or death. If there has been a case like that, it is exceptionally rare, but it is not zero for COVID infections if you do get vaccinated.
Amy, there's a question here. Once the schools reopen and the kids are back, how is MCPS going to ensure physical distancing between groups of children?
So this is tough, and this is what schools are grappling with now. The structures we've put in place is that students will be eating in their classrooms, or some or there may be days where the class could go outside to eat on the somewhere. If there's a huge all-purpose room, there may be 2, one class on one side and one on the other to maintain the 6 feet distance. We're not going to in elementary schools, the desks will, like each student's desk, which is 6 feet apart from the next with tape around it, are going to be facing forward. So you can't eat across from your friend and talk, even if, you can't sit across from your friend. It'll be structured that way. Buildings are doing things like figuring out, which sort of structuring it it's kind of what they're doing now, using their building structures to figure out how to, this class can go into the gym, so to speak, this time, but we're not going to have, I'll give you an example. One principal told me because not going to be a lot of visitors, parents aren't coming to volunteer, all that stuff. So he's going to have his teachers and school staff park on like one end of the parking lot and block the rest of the parking lot off, and that gives an extra outdoor space in the nice day, so you can keep, you know, you can spread your kids out farther. You know, schools are doing immense things with staggering recess, you know, staggering outdoor schedules, so that you're not having 200 students out on the playground, you're having just, you know, in very small groups, or recess stations. You know, these 5 students are assigned to this area. No longer can you kind of run across, you know, you have to pick your station. Do you want to be at the basketball hoop today, or do you want to be on, you know, this today? So a lot of it is just going through each part of the child's day. There's not going to, you know, this is not going to look normal. It's not going to be, hey, let's get 2 kids, you know, take the attendance down to the front office now, or, you know, can you go give this over to another class. It's just going to be very, very structured. Art, music, PE are probably going to be virtual still. So it'll be the art, music, or PE teacher, maybe from in their building, but delivering the art, music, or PE on the Promethean board. PE could go outside it, but, you know, so you don't have an art teacher going among 5 different classes and seeing, you know, 12 students every, you know, at one point every day, that kind of stuff. Students are largely going to be with their classmates. You know, I have to tell my child when he goes back that I hope his best friends are in his cohort, are in his group, his A or B rotation, because that's the people he's going to spend all his day with. From the moment he gets there until the moment he leaves, that's going to be his friend group.
Thank you. Any other questions? I'm going through, there was a question about the, I put the link again for registering for the vaccine in the chat. Let's see, here's one. When you have COVID, how many days do you have to wait in order to receive the vaccine? So if someone's had COVID, are they eligible to receive the vaccine?
The answer is yes, they are, and they're still encouraged to get the vaccine. That said, if you've had COVID recently, let's say within the last couple of months, you will have remaining protection, and I would just encourage you to, you know, you don't have to jump to the front of the line. You should still absolutely get vaccinated, but if you've had COVID recently, you're going to have many months of protection before you'll need the assistance of a vaccine. And so, yes, you should still get it when you have an opportunity to, but you don't necessarily need to jump and rush to the front of the line to do it while we're short on vaccine.
I have a question.
Yes.
Dr. Stoddard, you said many months. How many months?
So actually CDC, I think it said 3 months minimum, but I actually just saw some studies come through yesterday that have suggested that it's more like 6 to 8 months at a minimum. Obviously, COVID hasn't been around long enough for us to know exactly how long you have in the community. It's been just about a year now. And so I think it's looking increasingly like at least 6 to 8 months. My guess is it's longer than that. My guess is that it's probably at worst an annual booster you'll need once you've had it, or once you've had the vaccine and need to get boosted. But we'll know more about that. It's just if you've had it within the last 3 months, the CDC says you're good. I speculate that it's substantially more than 3 months.
Great.
One more question. When after having COVID, can you get tested and see if you have antibodies?
Yes. There are a number of LabCorp, and some of the big laboratories have some very good antibody testing. I would just be cautious. You may, if you have a specific place that you want to try and get in, there are a lot of antibody tests out there. Some of them are better than others. And if you want to have confidence in your antibody status, I would just recommend that you use one, do a little bit of research, find one that people have found to be effective, and go with that. But there are absolutely good antibodies.
Do you know of any you can suggest?
Yeah, LabCorp, some of the big laboratories, LabCorp, Quest, have very good systems that they utilize. There's just a lot of smaller name vendors who have marketed antibody tests that may not be as effective. LabCorp and Quest aren't the only ones, but you'd have to make sure you pick something that a very reputable testing company has, and you can just usually tell that by volume.
Thank you, Dr. Stoddard.
Okay, there's
Hello.
a question here. Yes.
Dr. Stoddard, I have a question. Can you talk about the side effects of this virus, long-term, short-term side effects. I'm asking this because my husband had a COVID and he was hospitalized twice. He developed a blood clot in his lung. That happened on May. Until now, he still has some lingering, and he's rapid heart rate, and it's been so many months, and I wonder is there gonna be he's gonna be ever cured 100% from that COVID?
Yeah, so thank you for sharing that. So first off, I'm sorry, I'm sorry that your husband's still having those issues, and obviously this is not it's not a common, but it's also not that incredibly rare to have what's referred to as long COVID or some long-term side effects from COVID. It's a small percentage of people, but it's not zero. It's more like 5% of people have these long-term COVID symptoms. So what I think we've learned from COVID-19 is that it's not just the typical respiratory virus in the sense that you see your lung infection, you get sick, you recover. In some people, you see longer term circulatory myocarditis, which is a heart inflammation. You see significant deterioration of lung capacity and long term from scarring of the lung tissue and other things. There are neurological impacts. Some people feel, not just the fatigue of being sick, but feel like they need to sleep from sort of a neurological impact for a long period of time. It's, again, not common, but also it's a measurable thing. Some number of people are going to have this. Most people from those long symptoms do ultimately recover. I don't know that we can say that all people ultimately recover, because obviously there's still people experiencing those long symptoms now from 6, 8, 10 months ago, and they're still experiencing them. And so you presume eventually that those people will begin to recover. But candidly, I don't know that every single person will always recover. It is, again, continue to get treatment and continue to consult with your medical provider. I certainly hope that everyone recovers for your family's sake, but we just don't. We think we know a lot about COVID. We don't. I mean, we still are learning things every day. We will be still learning things about COVID 5 years from now from this experience. And I wish I had more answers than I do for you, but I don't think anyone does at this point in some cases.
Thank you.
Thank you.
Let's see if someone, there's a question here. I want to see if I can get to these. Sports, what are the restrictions about sports playing right now in terms of, I guess, full contact, semi-contact?
Yeah, so we've had a lot of conversations about sports. I know we've been talking to MCPS about some of their sports activities as well. This is something that we're looking at, and I think I talked about in the beginning of it. We're looking at some of our restrictions, particularly over the coming. We're talking like by the end of the month, we're going to be looking at restrictions. I think if we see continued downward trends like we're seeing right now, you will see an expansion of some of the things that we're allowing. Right now, sports are required to abide by our gathering limitations, which for indoors is 10 people, outdoors is 25 people. I, as someone who's a pretty big sports fan, know that there are very few team sports you can play with 10 people or fewer. When you include coaches and referees and other things like that. I do not believe we are long away from an expansion, likely back to where we were before we went to 10 and 25, which was 25 indoors, 50 outdoors, which for most team sports is sufficient to play an indoor game with limited spectators. I would guess we're going to be back to that over the next few weeks. I know that MCPS is talking about the fall season, which is really delayed from last fall into the spring season. I think it's March, basically second week of March through the third week of April is roughly the time frame. I think that is a reasonable time frame to consider that we'll likely be expanding our allowances for youth sports to include that. I see a question about basketball that was sent to me privately. We are also talking about some of the, I think they were for high risk sports, more high contact sports like basketball. We're having those conversations as well. I don't want to make a promise that we're going to be in place for that. I would say if we see the continuing trends, we're at pretty much a steep straight down line right now with COVID. If anything like that continues, like I don't want to say if we flatten out from now, we'll be doing everything, but if we continue with a downward slope, I think there's a very good chance that we'll be talking about some of those sports over the coming, weeks, not months.
So I can tell my son that baseball season might be a go.
As an avid, I'll tell you right now, I've already booked out April 1st, which is opening day for the Major League Baseball on my calendar. So I'm a big baseball fan. So if we can get there, I've been working a lot of hours. I'd love to be able to kick back and watch some baseball. I'm sure if kids would love to be able to play it. Run up. So if we can get there, we're going to get there. I think I believe in that. So.
And I do think it's important to stress, when we get to that point, we are still masking, we are still physical distancing, and we're still washing hands, just to remember not to lose that perspective.
Yeah, certainly the amount that we get to reopen will be largely dependent on how well we have gotten better as a population at adhering to distancing and face coverings. We're seeing COVID downward trends, even in places where it's still incredibly cold and very, very winter-like. It's not to say it's not winter-like here, but even colder and more winter-like than we are here in Maryland. And so it's not just a seasonality thing. People are actually getting better at doing what we have asked them to do. And if we continue to do that, there are countries across the world, certainly Australia being the most common example of it, where they're going to concerts and things. So it is an achievable thing for us to keep these numbers down and still be able to enjoy a mostly normal life. It's just a matter of we need to have a collective commitment to getting there and following the guidelines and doing the things we need to protect ourselves, our families, and our communities.
Great. Amy, I didn't want to leave tonight's session without asking, I was looking at the questions I sent you, and I just wanted to revisit again about itinerant services and supports that children receive through PEP, or infants and toddlers. Can you explain a little bit how that televisit is working and how it's going right now?
Right. So infants and toddler services, since back in March, pivoted to providing televisits, teleintervention. So, a child and family would meet, where typically the speech pathologist would go into the home and meet the child and the parent there for the parent coaching. They'd schedule a time, 1 o'clock every Tuesday. They'd get on through telehealth, through video, essentially an equivalent of a Zoom call, and do the coaching that way. And it's actually, I think infants and toddlers providers have gotten really, really adept at that. I think some of that is, you probably are the ones being, childcare providers are the ones being coached in some cases, because the children are just like infants and toddlers providers used to go into childcares to do the adult coaching there. It's happening virtually, just on a video call. Just like when you go, you have a telehealth appointment with your doctor, it's just that it's a 45 or an hour long call, and you're talking about strategies and that kind of stuff, and coaching, how's it going with this, et cetera. Students who've been receiving itinerant PEP services, so they've had have had a teacher, speech pathologist coming into a pre-K, so not the infants and toddlers model where it's really a coaching model, but coming into the pre-K or the childcare, the private facility. And before the pandemic, the itinerant teacher, and we have about 10 of them, go, every, Thursday at 9, go for an hour to the childcare and work with the child there, and, on specialized instruction. And the speech therapist might go another day. And that we haven't been doing. And that's been a lot of the families, that's looked like very different things depending on what's working for the family and the childcare. We record all of the lessons. So all the pre-PEP instruction, every teacher is recording his or her lessons every day. So a lot of families are just watching those videos at night with their children. So it's not interactive, but they're getting, the instruction. And the families are saying, my child's in a childcare or in a pre-K and it's going really well, I don't want to mess up, anything that's going well now, but we're watching the videos every night. Or, right before dinner, I put on the videos and we talk to our teacher that way. So that, that can continue. Or there are some of our PEP itinerant teachers who are doing televisits in the childcares where that's possible and where the family, that's something that works. So a variety of different things are happening there to accommodate that we can't go into the facilities, and those will continue. So the recorded, all of our teachers record all of their lessons every day, and the parents have the links, and that will continue. Not for the in-person, but there will always be recorded lessons because every family could opt to stay virtual.
Yeah. I think I'd be remiss if I didn't talk about, we just ended a 3-part series of chats with childcare providers and ITP and PEP staff to really talk about how to engage with the televisits and how to support children. And it was such a success that staff are now looking at what are the next steps so we can continue that discussion, because what we're finding is the communication is so essential right now between all parties, so that the child is receiving the best care and having consistency, which we know, keep stressing, right? Routines and schedules are super important for under 5. So, so yeah, I think that, watch for that email for the webinars on how to work and support children who are receiving services. It is kind of odd, right, to have a monitor and talk through a screen, and but I think if we can maximize those. So for providers who currently have some successful stories, I ask that you please send them our way. We really would like to highlight those. I know the 3 sessions that we just had were really informative, but we just want to keep growing from this. And, the world is different now. And so, this is not going to change overnight. And I think that we need to continue with some of these practices.
Can I throw in one more thing? And I know we're at time, but can I take 30 seconds to also say, I want to make sure that if there are families and childcare providers who have concerns about a child's development. So, they are concerned, just as they would always be, that the child's development, language development, motor development, cognitive development, social development isn't progressing as you would have anticipated. Our assessment services and eligibility is fully up and running. Some virtual, some in person, but we are assessing students and finding them eligible for special education services through infants and toddlers or Child Find every day. So that the fact that we are in the midst of virtual learning should not be a deterrent to making referrals to Child Find and infants and toddlers at any time. We want them. We want the referrals. We want to know about them now.
I just dropped the link for Child Find. So if anyone has questions about that, I'll do the ones for infants and toddler in a minute. So our time is coming to an end. And I want to thank Dr. Stoddard and Amy Cropp for spending this hour and change with us this evening to answer questions. It's a lot. This is an ongoing discussion that we're going to have with our childcare community. Dr. Stoddard has been so nice to carve out an hour each month so that he can be available to us and ask these questions. COVID is ever changing. COVID is, we're always learning new things about it. Information change, as Amy had said at the beginning, it changes on the minute. And so we try to keep up as much as possible. Please, if you receive our e-blasts, don't delete, keep reading them. You can follow us on social media. We are on Facebook, we are on Twitter and Instagram, at MCCCRRC, our initials. We try to post as often as possible, information, links, resources, supports. Whenever we get new information, we put it out. E-blast is the other way. You can go to our Facebook page and connect to our e-blast, and you can ensure that you'll get those messages. Again, thank you very much, Dr. Stoddard and Amy, and thank you everyone for spending this evening with us. We'll send out the next invite for the March session about a week and a half before the actual event. So with that, I leave you. I understand a big snowstorm is going to hit us, so stay warm, stay safe, everyone. Mask up and wash hands. Good night.
Thanks a lot. This was great.
Great, thank you.